the pleasure of introducing Dr. Susana Marroquin. Dr. Susana Marroquin is a licensed marriage and family therapist, PsyD, and a specialized maternal mental health clinician. So you see why we have her going next. She has extensive knowledge in the mental health field and has worked in several settings, such as homes, schools, in private practice, and county nonprofit organizations for the past 15 years. Her experiences range from child behavioral health issues, parenting, communication and relationship individuals to individuals suffering from depression, anxiety, loss, or suicidal ideation, and more. She earned her master's and doctorate in marriage and family therapy from Alliant International University in Irvine, California, and is currently finishing her doctorate dissertation, PsyD. Okay. She is a member of the Association of she's a member of the California Association of Marriage and Family Therapy. She is a mental health advocate, speaker, and educator in the community with services in both English and Spanish. So please give some snaps for Dr. Susana Marroquin.
Wow.
The Dr. Susana Marroquin.
Susana. Thank you so much, Lauren. Thank you. I'm so happy to be here. And wow, going after you. You set the level high. I really want to piggyback on some of the things you stated, because one that really stuck out is the suicide rate being so high between that 12-month mark of mothers after giving labor. It is extremely something that I have seen in my practice for the last 10, 15 years just spiral. After COVID, we saw it go up probably a lot more. 50% of mothers who are pregnant will suffer anxiety and depression during their pregnancy, which is more likely to continue after they give birth. The chances are that it will continue if they have a second child. There's that 50% chance that it will be present or not. In the Latinx community, we don't talk about this, right? I am Latina, first gen, Central American parents. And I was raised Catholic, so we don't talk about the suffering of the mother. We just normalize it and sweep it under the rug with, this is what it is to be a mom, or you're sleep deprived, or you should have thought about it before having a child. So there comes the shame, the blame, the guilt in our community. And so it's really hard for us to open up about this.
Yeah.
Again, this is a calling for me. I have a 9-year-old and I experienced postpartum depression and anxiety. I had anxiety and depression while I was pregnant, and it definitely intensified after I had him. I had a hard time sharing that with my mother. Not because I was afraid of sharing it, because as a clinician, I did the checklist in my head, and I'm like, this does not seem right. I know that I'm sleep deprived, but this doesn't seem normal. But because I got the judgment, and I got the guilt, and I got the shaming. So I knew that if she did not understand where I was coming from, that it would only make me feel worse, which it did.
Wow.
And in our community, that's what ends up happening. I have moms who come in and say, I don't know how to have this conversation with my family. I don't know how to tell them, because another thing in our community is we're so religious that we will say, pray, right? Go to church.
Right.
Seek community in church, which is all wonderful, and it's absolutely something that I know we have all shared already, seeking support and having that. Yet a mother who's in that despair in that moment, hearing those things, will internalize that and say, okay, I'm not doing something right. I must be a bad mom. I've prayed, but nothing's changed, so then I must be a bad mom. Yeah. And so there's this very interesting dichotomy where in the Catholic religion, Virgin Mary is placed very highly. And so we have Marianismo, where as mothers, what that means is we look to be like the Virgin Mary. So to say, I did not do this right, I need help, makes us feel extremely incompetent and not good enough. And with Marianismo, we have seen throughout the years that with studies that actually ends up being more of a double-edged sword, and it doesn't really make the mother feel any better, because there's this immaculate conception of a woman on a pedestal who's done so much right? And so what we translate that is, then I must continue to be a martyr for my children, which means I should sacrifice my well-being, my mental and emotional suffering for that of my child. Where in reality, what my practice says is a healthy mom is a healthy family. If we're not healthy, we cannot do that for our children. We can't model, we can't teach them what it's like to be healthy. And so a lot of moms come into my practice and say, well, how do I do that? I've seen my mom put herself through the grinder, working 2 jobs, you know, taking care of everyone else's needs, making sure all the wildfires are put out, but mom doesn't eat, she doesn't sleep, she doesn't go to the doctor, she prays, because religion is still very important in our families and in our communities. But what else should I be doing? How do I ask for support? Because we're told you're not supposed to ask for support. You're supposed to go to the confessional, you know, share with the priest what's going on, pray some Hail Marys, Holy Fathers, but at the end of the day, where do we go for that community of the clinician, the psychiatrist, who, again, like you both stated, understands that it's okay to be religious, but also seek support outside of that, right? Because it has such a negative connotation. If we tell our families I'm in therapy and I'm taking medication, whew, are you crazy? We don't do that. You know, we sweep everything under the rug, or we say we don't air out the dirty laundry, right? Everything stays in the house. You know, we'll say, go talk to the comadre, we'll go talk to the neighbor, right? That's great, but what else can we do? So in my practice, we are working through healing that mother wound, because again, we do carry that, and it's intergenerational. Our mothers probably had postpartum anxiety and depression. Our grandmothers, there's a lineage of all these women who have suffered and who have sacrificed themselves for their children and their families. I'm an only child. I saw it in my own mother. And I would say rest. Well, rest is also seen very negatively in our community. If you rest, you're lazy. You're not using the time to your best ability. You know, we're here to work. So that mentality of I must keep doing, I must not rest, translates to I must put my own suffering on the back burner. I must put my own needs on the back burner for that of my family. And how do we teach that it's okay to be the person who says, I'm going to go to therapy because I want to be healthy for my children? Well, that's what we're breaking away from in my practice. I incorporate different ancestral healings, because that's another thing that we've noticed, that we're steering away from traditional Catholic beliefs, right? There's young women who come in and say, I'm Catholic, but I don't agree with everything that Catholicism has taught me, or that my parents still uphold very highly in the Catholic religion, but I have some different views and different thoughts about it. Okay, well, how do we incorporate the two? How can we have a family therapy session where we can all hear each other and be very respectful of the fact that, you know, our older traditional, you know, ancestors are going to believe very different to that newer generation who's saying, well, you know, I can be religious and still go to therapy. I can be religious and maybe not go to church every Sunday, or take medicine because I feel and I see the benefits of therapy, medication, and everything else that community may offer. So we do incorporate this in our practice, where we are looking at rituals and healing. There's a lot of circles of healing now, where a lot of moms are also seeking different ancestral medicine. It's not just medication. It's not just, you know, pray about it. There's so many other forms of modalities that we incorporate. But one of the things that's really important that I think we've all spoken about, and I will reiterate, is community. We have to be out in the community talking about this. In my practice in Long Beach alone, when I decided to open it and talk about the disparities, was we don't have services in Spanish. I found a support group when I was going through it, and she's a great colleague and friend, but she was speaking in English and had someone translating for her. So what I noticed was the message was just getting chopped up. The mothers were still walking out and feeling unsupported because it was different. So that alone, the language barrier, financial barrier. Our insurance companies don't cover this. I just got back from Washington, D.C., like literally in the middle of the morning, because I was out there advocating for maternal mental health legislation with female reproductive justice. Because we need these.
Yes.
We need these bills passed. Our communities don't have the resources. Insurance doesn't cover it. Some of these families stay away from seeking support because they say therapy is expensive,
Yeah.
right? Or they find a therapist, someone said it about, it's okay to say I'm faith-based, but your therapist is probably not okay with it. Unfortunately, we haven't opened up our practices to say, I'm a faith-based clinician, or I'm open to working with you, even if your religion is so important. Teach me about it, right? We cannot just turn away people because, well, unfortunately, sadly, we do. Our system does do that, where we turn away people based on their religion, based on their beliefs. And so that really keeps perpetuating the ideology of seeking support isn't something that I can afford or that I want to do or can do, right? So it's really important to continue to create these spaces where people who come into therapy find someone who looks like them,
Yes.
right? And this is what I get when I speak with these moms. Oh, you get it. You look like me. You speak my language. You know the struggle. You know the hardships. You understand what it's like to be Latina. You understand what it's like to be first gen. I understand the nuances in our culture and how difficult it is to tell my mom, that's not how I'm parenting because I was parented so very different, right? And how do we allow that space to happen with being respectful of those ideologies? Because a lot of our moms of color, Latina moms, live with the grandparents, aunts, uncles. It's a multi-generational household, right? So this is really important in our practice because we need to be able to create these spaces, go out in the community and say, it's okay to seek therapy. You're not crazy. Destigmatizing that, also decolonizing that, because psychology comes from a very Eurocentric background. And let's face it, the theories that I was taught, the modalities that I was taught are not gonna work with my indigenous families of color, Latinx families. I can't sit there and have them do a humanistic approach when they might be in crisis. Someone was deported. Someone's incarcerated. I have single moms. I worked on a case a few years ago. I don't know if anyone heard of the mother in East LA who took the lives of her three children. So, again, someone said this could have been prevented. You did.
Yeah.
This could have been prevented. Family was in the system. She had seek support. You know, DCFS was involved. Fell through the cracks, not the proper resources for her. Family had language barriers, financial barriers. And then she took the lives of her three children who were very small. And of course, that got all the media's attention, right? I'm an 80s child. I remember Andrea Yates drowning her 5 children. And when I really thoroughly read that case, there was so many red flags of where she had asked for the support. There was diagnoses that stated she wasn't well. She could have been prevented. But again, we let these things happen in a sense, and then, like COVID, the wake-up call, right? When these tragic incidents happen, we're like, oh, what could we have done? Or, oh, we should have done this. We should have, we could have, but now we're doing it, right? We have to change the narrative of therapy. We have to change the way we focus there. If we're like myself, my responsibility as a clinician is to be able to accommodate the needs of the patients and the families that I work with and know that every therapy is not a one-size-fits-all. And in that, the 3 pillars that I work with are mental, emotional, and spiritual wellness. Because that was the 3 things that worked for me, and I incorporate that in my practice because spirituality is also something that is more of a feeling for some patients. For some moms is, how do I connect with my spirituality? What does that even look like? I'd like to explore that and move myself away from what Catholicism, because the majority of my patients practice Catholicism or were ingrained that Catholicism is the umbrella, the religion to everything, but they want to move away from that. So what does spirituality look like? You know, incorporating other forms of healing, creating community, going out in the community, seeking support from other leaders, and you said, or I'm sorry if I'm mixing it up. No, Lauren, you said it's an accessory, right? We are. It's not transactional. Well, it is seemed that way. But we do have to look at faith-based leaders and say, how can we work together from the beginning? What can we create that allows these moms, these human beings, these families to be nurtured and supported through their journey of parenthood rather than stigmatized and felt like they're being judged when they ask for help. So with that, I just want to say thank you for having me here. This is such a great topic, and I look forward to hearing from everyone else.